Mr. Speaker, pain. We all dread it, we avoid it, we even fear it. And we all go to extraordinary lengths to mitigate its severity and its duration. Yet a group of human beings are today subjected to a deadly, extraordinarily painful procedure, one of which is called the dismemberment method, the D&E. The Pain-Capable Unborn Child Protection Act is a modest but necessary attempt to at least protect babies who are 20 weeks old and pain-capable from having to suffer and die from abortion. Children, including children with disabilities, Mr. Speaker, deserve better treatment than pain-filled dismemberment. One leading expert in the field of fetal pain, Dr. Anand at the University of Tennessee, stated in his expert report commissioned by the U.S. Department of Justice, the human fetus possesses the ability to experience pain from 20 weeks of gestation, if not earlier, and the pain perceived by the fetus is possibly more intense than that perceived by newborns or older children. Dr. Colleen Malloy, Assistant Professor, Division of Neonatology at Northwestern University, in her testimony before the House Judiciary Committee said, "When we speak of infants at 20 weeks post-fertilization, we no longer have to rely on inferences or ultrasound technology because such premature patients are kicking, moving, and reacting and developing right before our eyes in the neonatal intensive care unit. In other words, there are children the same age in utero that could be killed by abortion and painfully, who have been born and are now being given life-saving assistance." She went on to say, in today's medical arena, we resuscitate patients at this age and are able to witness their ex utero growth. Dr. Malloy concludes, "I could never imagine," she says, "subjecting my tiny patients to horrific procedures such as those that involve limb detachment or cardiac injection." And again, that's what the abortionists do. Surgeons today, Mr. Speaker, are entering the womb to perform life-enhancing and life-saving corrective surgeries on unborn children. And they've seen those babies flinch, jerk around, move around, recoil from sharp objects and incisions. As they seek to heal, surgeons are today routinely administering anesthesia to unborn children in the womb, a best medical practice to protect them from pain. We now know that the child ought to be treated as a patient, and there are many anomalies, sicknesses, disabilities that can be treated with a degree of success while the child is still in utero. The child ought to be seen as a patient. When those interventions are performed, again, anesthesia is given. Last June, Time magazine's cover story, "Saving Preemies," explored the preemie revolution and how cutting-edge medicine and dedicated caregivers are helping the tiniest babies to survive and to thrive. Time says, thanks to advances that have been made even in just a few years ago, the odds of surviving and thriving are improving all the time. Abortionists, on the other hand, Mr. Speaker, are in the business of ensuring that children neither survive nor thrive. Children, including children with disabilities, deserve better treatment than pain-filled dismemberment. I yield back to my colleague, the balance of my time.